A very good morning, everyone. Today we will learn about pregnancy. The first point we will learn what will happen at the day of the pregnancies. What are the precaution measures at the time of the COVID-19? Mental health in the pregnancies, diabetes in pregnancies, blood pressure in pregnancy. So let's get started. First, what will happen at the day of the pregnancies? You will experiencing the pain in abdomen. The pain in abdomen would be it would be very severe. As soon as the time will pass, it will get increase. The pain would be the intensity, its duration, its frequency would be very worst. For example, initially at around 15 to 30 minutes, it will comes and the pain will remains for 30 seconds. As soon as the time passes, the pain of the frequency of the pain will comes by around 3 to 4 minutes. The pain which lasts for 45 seconds. So at the time of the pregnancy, at the time of the delivery, you will have a pain in abdomen. The second point, you will have a dilatation of cervix. What is the dilatation of the cervix? The cervix, it's like the dilatation of the cervix. It takes place around 10 centimeters. In the first pregnancy, it takes for the dilatation of the pregnancy, it takes around 10 hours. For the consecutive pregnancies, the dilatation of the cervix takes by around maximum 4 hours. The total complete dilatation of the cervix it is 10 centimeter. What will happen after the dilatation of cervix? That would be rupture of memory, explosion of the head of the infant, which to be done as the bearing down sensation, and the lady will be asked as to do bearing down sensation just like as she is doing while passing the stool. The next point would be what are the changes in the mother health. The systolic pressure would be increased, the pulse would be increased, she will have exhaustion, there will be profuse sweating, and there will be no change in a body temperature. What are the effect during this process? The effect in the fetus. As soon as there is a contraction of the uterus, the fetal heart sound gets reduced and it becomes back to the normal as the contraction of the uterus diminish. What will happen after the delivery? The pain in the abdomen will get reduced. There will be separation of placenta and a fetus is handed to the mother for breastfeeding. Coming to the point on precaution during the COVID-19. There are 3 points. Point number 1, in the pregnant woman. What is the 1 point? First point is you need to stay at home. You should not go outside, and you need to wash your hand frequently with the soap and water or with alcohol. If you are a nursing woman, what you should do? You should wash your hand before and after touching the baby while feeding it. Second point, wash the clothes and sanitize all the utensils or articles that comes in contact with a mother and baby. If you are COVID-19 positive, what you need to do? You will wear a medical mask. You will wash your hand with soap and water. That would be routine clean and disinfecting the surface which comes in contact around you. So we have up till now we have learned the 2 points. What is the 1 point? What will happen on the day of the pregnancies and what are the precaution measures if in the COVID-19? Coming to the point on mental health. When you are pregnant, you will have a happiness. You will have fear of delivery. You will have many negative thoughts whether I will be the good mother or not. The remembering of the past delivery complications. There would be the fear of weight gain, changes in the body shape, and there would be changes in the relationship. What you can do? You need to talk. You need to talk to your doctor, friends, family, and you need to make a new friends who are pregnant women, who are newly women, pregnant women. You will eat a balanced diet. You will do something that will enjoy to you. You will have a proper sleep. You will go with the meditation. You will go like yoga. And lastly, which is very important, you will not search anything on Google. Whatever doubt you have, you need to talk to your doctor and get answer from them. Please. Why I am focusing on the mental health? Because it will affect on your diet, it will affect on your sleep, and ultimately what will happen? There would be effect on the infant health development. Coming to the next, blood pressure and pregnancies. If it is not controlled, what will happen? It will happen a growth retardation. There will be preterm delivery. You will have a protein loss. There will be swelling of the body. How you will control? Proper balanced diet, proper sleep, regular medicine by the doctor, and lastly, you will avoid your stress factors. So, coming to the point, which is around frequent questions, what we should do in diabetes. So, let me explain diabetes and pregnancies. Who will cause? The lady who are obese, the lady who is pregnant beyond 30 years, the lady has a previous dead child, a parent's family history of diabetes. There would be the worry and anxiety in his process of duration of pregnancies. And who will get more? The lady who has a recurrent vaginal infection. What will it affect if it is not controlled? If it is not controlled, what will it affect? It will cause you hypertension. It will cause you will get a hypertension, you will get a preterm delivery, there will be the failure in lactation. What will happen to the baby? The baby will get a growth retardation. There will be abnormalities in the head and shoulders. The baby will be obese. He would have a childhood diabetes, and if it is not controlled, there would be the fetal death, and it will cause you. If it is not controlled by the proper balanced diet, medicine, and it should be controlled after the full delivery. If it is not there, you will have a cesarean delivery. What you should do? A regular blood check, routine visit to the doctors, avoid stress, anxiety, proper sleep, and have a proper balanced diet. That's all for now. Hope all your points has been covered. Till then, stay healthy, stay blessed. Dr. Moiz Godiwala signing off. Bye bye.